GAMEKIDS HD.
Live virtual surgery, Multisurgery Hospital. Call 911.
Clean the blood with the cotton. Apply some ice on knee. Apply the ointment on it. Tie the bandage on the wound.
Ambulance has arrived.
His knee is badly injured. I think it needs a surgery.
Ouch!
We need to take him to hospital as quickly as possible.
We have reached to hospital. Let's take him to emergency ward.
Hello, I am Dr. John. I'm here to guide you throughout the procedure of knee surgery. Let's check the vital signs before the surgery. Apply the betadine solution on the entire surgical field so that the patient's leg is bacteria-free. Soak the sponge into betadine solution and apply it on the leg. This will reduce the chances of any type bacterial infection. Draw the outline with the help of marker on the patient's knee. With the help of marker, draw the incision line. Take the scalpel to make a cut on the marked area. Use the bovie to cauterize the bleeding veins to reduce the blood flow in the surgical field. For the surgery, patient's knee should be elevated so that patient's knee is fully exposed. Patient's leg is in proper angle. Take the wronger and then tap on the meniscus and each of the 4 bone spurs to reshape the bone. Now use the drill and make a hole into femur. Put the jig into its position, and also the alignment device. Use the mallet and insert the jig pins, so that the jig is firmly placed. Remove the alignment device. Use the bone saw to cut the bone. Take another cutting jig. Along with the bone saw, allows us to finish shaping femur. The tibia cutting jig is aligned with the big toe and the highest point of the tibia. This will make sure that the leg is properly aligned even after the surgery. Now use the bone saw to shape the highest point of tibia. Use the bone saw to cut the patella. Take the plastic spacer and insert into metal tray component. Now take the metal tray component to attach it to tibia bone. First, attach the femoral component on the femur, and now take patellar component and attach it on the patella. Take the cement and spread it on the surface of femur bone. Check the range of motion of the patient's leg. Hold the foot handle and drag the leg left slowly so that components are properly bonded with the cement. Wait for 10 to 15 minutes so the cement can dry properly. Now it's time to stitch up the fat layers. Use the stapler or suture to close up the incision. This can't be your first knee surgery, is this? Oh, she's going to have a baby. We need to take...
Call 911.
Give her some water to drink. Give her an oxygen mask. Ambulance has arrived.
Don't worry. We'll be reaching soon to the hospital.
We have reached to a hospital. Let's take him to emergency ward.
Hi, I am Dr. John. C-section is basically find a suitable vein, sterilize the incision area. Now insert the needle. Tap on the needle to remove it. Now application of alcohol wipe will sterilize the area. Inject the local anesthetic around the patient's spine.
Inject the local anesthetic around the patient's spine. Clean the patient's abdomen by applying antimicrobial iodine solution. Use the scalpel to make an incision in abdomen. Use the suction to clean the excess blood. Insert the retractor. Use the scalpel to make an incision. Apply the pressure. Tap on the baby's nostrils and mouth to remove the fluids from it. Remove the baby from the uterus. Now cut umbilical cord. Drag the placenta out of the uterus. Suture the different layers with the help of thread and needle. Congratulations! You did a great job by delivering a baby. Ow!
Call 911.
Ambulance has arrived.
We have to take him to nearby hospital. Meanwhile, let's give him first aid.
We have reached to a hospital. Let's take him to emergency ward.
Hello, I am Dr. John. Sterilize all the nails of feet to disinfect it. Wait for a few minutes so the toe gets numb. Inject the local anesthetic on the toe. Place the tourniquet around the toe to reduce the amount of blood coming from wound. Now cut away the nail as indicated. Drag the ingrown nail slowly in order to remove it from the toe. Wipe away the blood. Wipe it again. Squeeze the toe to remove the pus from the infected toe. Now apply the phenol acid on the wound. Cut the tourniquet. Apply some amount of antibiotic ointment to sterile gauze pad. Wrap the toe with the bandage. Congratulations! The surgery you did was perfect.
Call 911.
Clean the blood with the cotton.
Ambulance has arrived.
The patient is in serious condition.
We need to rush to the nearest hospital to save his life.
We have reached to a hospital. Let's take him to emergency ward.
Hi, I am Dr. John. Today we have a patient, and he has severe injury on his head. I will assist you in the entire procedure. Let's begin with the surgery immediately.
Take the shaving cream.
Take the razor from the toolbar. Shave the head properly. Take a marker. Draw the dotted lines. Take the scalpel. Now make an incision through the skin of the patient's head. With the help of the scalpel, cut the muscle to gain access to the skull. Take the drill. Now drill 4 holes into skull. Take the surgical saw. Now cut the skull so that we can get access of brain. Take the scalpel. Now make an incision through the dura mater. In order to open the brain, gently open up the corridor with the help of retractors for access to the aneurysm. Use the microscope to look inside the skull. Take the dissector tool. Now remove the retractors from the patient's head.
Take the needle.
Take the drill and make 4 holes through the bone. Place 4 of them into the skull. Take the screwdriver. Pick the needle to suture the muscle. Now suture the skin of patient's head. Pick the bandage. Congratulations! You made a successful brain surgery.
Call 911.
Ambulance has arrived.
He has a severe pain in his stomach. He needs an immediate treatment.
We need to move to the nearest hospital for his treatment.
We have reached to a hospital. Let's take him to emergency ward.
He went for dinner, and while having food, he has severe ache in his stomach. Let's help him out by getting it out from...
Let's begin the surgery by taking X-ray of patient's belly. Drag the red cross toward the mark X. Well done! We can see the object inside the patient's stomach. Intubate the patient to ensure the proper... Take the throat opener and insert into patient's throat. Good! Now take intubation tube and insert it into the patient's throat. Carefully remove the throat opener from the patient's throat. Connect the intubation. Turn on the lung pump. Take a marker and draw a line. Use the scalpel for the incision. Take Bovie tool and burn the vein shut to stop the bleeding. Use the clamps to move the skin and flesh out. Take scalpel and make an incision so we can remove the object from the patient's belly. Take the insert it into the patient's stomach. Good! Now we can see what's wrong inside. Now, carefully insert tongs into incision and remove the object. Use the needle and thread to stitch the stomach's cut. Take the needle. Turn off the lung pump. Disconnect the air tube. Now lastly, remove the intubation tube. Congratulations! You did a great surgery.
Live virtual surgery, Multisurgery Hospital.
Thanks so much for watching videos.